Hi, this is NURS 125 Nursing Physical Assessment Lab Prep. The preparation for this lab will be on Blackboard. You can get your student handout. It tells you the readings, lectures, and that sort of thing. There will be no other specific PowerPoints for this lab other than the ones that you already have from lecture, and they've been quite detailed, so you can review those if you need to. There's a nursing clinical assessment form available in the Blackboard or in Genzabar. Please bring a copy of that and familiarize yourself. And of note, there will be no Mosby's assignments or videos for this lab. We will be focusing on techniques of physical assessment. You've had all the overview and details in lecture, and this will be hands-on, implementing and beginning to use those. This is a list of some basic equipment that we'll actually be using in our lab. As you know, there's a lot more equipment that can be used, but we're going to stick to a basic physical assessment. So maybe probably the only thing maybe you haven't used here by now is the pen light. You probably had practice with the Doppler already. Physical assessment, if I leave you with one thing, is it's systematic. And usually we go head to toe, but the systematic means you have an organized thought process, so when you actually doing your assessment, you don't miss things, okay? And that is only developed with practice, practice, practice. And that's our job to help you with that. And your physical assessment is going to be the objective information portion. What do you observe, and what is your actual hands-on examination? I just want to make sure a little bit about Stethoscopes 101. If you don't have one, make sure that you check one out in the lab first before you go and buy one. If you have one, perfectly fine, bring it. And just wanted to make sure you understood the parts of a stethoscope. The earpieces, for example. The earpieces, when you put them in your ears, you can point them forward or back, but your anatomy, you want to have the earpieces pointing forward when you put them in the ears. You hear best that way. The diaphragm is the device on the end of the tube, and this is where you actually will be transmitting the noises and the sounds. There is a bell side, which is up here, and then the diaphragm side. Some people only have stethoscopes with a diaphragm. That's perfectly fine. The bell is used to pick up some more detailed heart sounds. It is completely up to you which you use. I do suggest you buy a good stethoscope, because it's one that you will be using. It'll be yours, and the better the stethoscope, lots of times the better that you can actually hear. But again, I've also thrown in here a bit on terminology. I know you've discussed this in class somewhat, but I thought maybe this might be helpful to you, is to make a list of the systems that we're going to be assessing, like neuro, cardiac, integumentary, that sort of thing. And then, using your text, look up the descriptors that you use to describe each one. It's like you can't say, well, integumentary is normal. What does normal mean? And those descriptors do have medical meaning, so you may, again, want to familiarize yourself. For example, you've got a normal eye, you're looking in the eye with a pen light, and your assessment is equal, round, and reactive. What does reactive mean? Is it brisk? Is it slow? Those are the types of things that you need to learn as far as the terminology. Again, you're not going to be a pro at it, or we're just starting this process, so give yourself a break. But come prepared. It makes it a lot easier for you. Personal preparation. Make sure you've got a clean uniform, you've got clean hands. I shouldn't have to say that, but I do. Short nails and no chip nail polish. I always prefer, if you're going to have nail polish, that it be professional looking. You cannot have long nails when you're examining patients. And the chip nail polish harbors microorganisms. So again, no chipped nail polish when you're working with patients or in the lab. And always use proper body mechanics to save your back. This is when you're beginning to, you're literally using your body when you're doing the assessment. So what's wrong with this picture? Now, if you had several patients to examine like this, by the end of the day, your back's going to be killing you. So what could you do in this example? Raise the bed to your height. Prepare the patient for the assessment. Explain why you're doing it, when and where, that sort of thing. If the client needs to be prepared, maybe empty their bladder, change some clothes, get comfortable, and also make sure that you have the right lighting, temperature, and that sort of thing. So it makes a difference when you're actually doing it. So the best practice for as nurses for a routine physical assessment, and I underscore routine. This is not something that is a focused. It's not something that's needs to be done right away. It's routine. You can integrate it into your personal care, your personal nursing care. And a bath, for example, is an excellent time to incorporate some assessment. We've got a baby here in the picture, but can you imagine the amount of assessment that you're doing while you're bathing this baby? You're touching the baby, skin temperature, you're listening to a cry, you're looking for symmetry, movement, color, all that stuff, and you're just bathing the baby, and you have all kinds of information. This is a great slide as far as using your senses to collect client data, and I won't read it through, but take a peek. This is what you'll be doing, so it's a good idea to understand what is it can I see, what can I smell, what can I hear and touch when I'm evaluating someone. So it's a bit more detailed than sometimes you think. First, do a general survey. When you walk in the room, just as we did in our first simulation, that 1-minute assessment, you're walking in the room, what do you see? What do you observe? And this is when you're going to pick up the big things, but also pick up some details. Take a look at the woman that we see here in the picture. She is sitting up in a chair. She is dressed in clothes, but she is leaning to one side, and she's propped up sort of with a pillow. That right there tells me that we have a problem with symmetry. She probably has a musculoskeletal issue, and we know where we're going to have to focus our assessment right when we go in there, the system that we're going to focus most on. So don't forget that 1-minute assessment when you walk in the room when you're doing your physical assessment also. Now, assessment techniques, inspection to percussion, I'm not going to go over that. We'll be practicing it in the lab, but make sure that you're taking time to observe. You cannot do inspection by itself. You do it alone and in combination with other techniques, okay? So you kind of blend them together, and we'll be doing that in the lab. Be systematic in your approach. As a new student, you're probably going to want to use your clinical assessment tool. That's what we're going to use in lab. And always, always compare side to side. Making an assessment on one side of the body and not doing the other side of the body is moot if you don't compare side to side, because that's where you're going to pick up the differences. Alrighty, so make sure you're always doing it bilaterally. We'll be assessing systems in the lab, example, respiratory and tegumentary. And for example, lung sounds. Here's an example of bilateral assessment. If you start below the clavicle here, you're going to go to the clavicle there. You're going to go from one side to the other. You just can't go up and down, or you won't be able to make a good assessment. Always listen on skin, not through clothing. That goes for bowel sounds, pulses, that sort of thing. And for example, here, normal sounds for lungs are broncho and bronchofascicular. This probably is new terminology for some of you, so it's what you want to be prepared for and know what is it that how you're describing those lung sounds. So again, add that to your terminology review. And let's see, listening, we're still talking just about respiratory, but you can take that and what you've practiced in lab and take it home and practice on your peers, your family, that sort of thing, anybody that'll let you, really, and try to identify those breath sounds. Are they bronchial? Are they bronchial-vesicular? Somebody have a bad cold. Are you listening to rhonchi? You get somebody with asthma and they're wheezing. You need to begin to identify those. And you need to know normal before you can really go abnormal. So practice, practice, and that goes for every single system that we're talking about. So again, that was just an example. So for the lab, in closing, make sure you bring your volume 2, Bring your clinical assessment form, stethoscope, blood pressure if you have it. Be prepared and to use your vocabulary, that your newfound vocabulary. You'll be working with a partner. You'll be doing assessments on each other in the lab that will set up by systems, and then we will close by assessment simulation that you'll participate in. If you have any questions, don't hesitate to email me or talk to me. And that is it for this one. I'll see you in the lab.